patient is scheduled for heart surgery, whether it is coronary artery bypass grafting, valve repair or replacement, or another major cardiac procedure, most attention naturally focuses on the operation itself. Yet one of the most powerful determinants of surgical success lies not only in the operating room but in the days and weeks leading up to the procedure. Because smart surgical preparation through intentional lifestyle shifts can significantly influence surgical risk, healing speed, complication rates, immune resilience, and long-term recovery outcomes, and understanding this empowers patients to move from passive recipients of care to active participants in their own success. The first and most critical area of preparation is cardiovascular stabilization, which includes strict adherence to prescribed medications, especially blood pressure regulators, antiplatelets when advised, diabetes medications, and cholesterol-lowering agents, because entering surgery with controlled blood pressure, optimized blood sugar levels, and reduced inflammatory markers lowers the risk of intraoperative complications and improves tissue healing capacity, and uncontrolled hypertension or elevated glucose levels can impair wound healing and increase infection risk, making medication discipline non-negotiable. Equally important is nutritional optimization, as the body will soon undergo significant stress and must have adequate protein reserves, micronutrients, and balanced energy stores to support tissue repair, immune response, and recovery, so patients should gradually shift toward a heart-friendly diet rich in lean proteins such as legumes, fish, or poultry, abundant vegetables and fruits providing antioxidants, whole grains supplying stable energy, healthy fats like olive oil and nuts supporting vascular health, while reducing processed foods, excessive sodium, refined sugars, and trans fats that contribute to inflammation and fluid retention, and hydration should be consistent but balanced according to medical guidance, as adequate fluid supports circulation and kidney function before anesthesia. Smoking cessation, if applicable, is one of the most impactful changes a patient can make prior to surgery, because nicotine constricts blood vessels, reduces oxygen delivery, increases clotting tendencies, and impairs wound healing. So even a few weeks of cessation can meaningfully improve oxygenation and surgical resilience. Moderate physical conditioning within approved limits also enhances surgical readiness, because light walking, breathing exercises, and supervised prehabilitation programs strengthen respiratory muscles, improve circulation, and reduce post-operative complications such as pneumonia or prolonged weakness. And pre-surgery conditioning does not require intense workouts but rather consistency and safe movement that maintains muscle tone and endurance. Respiratory preparation deserves particular emphasis, as learning diaphragmatic breathing and incentive spirometry techniques before surgery allows patients to perform them more effectively afterward, reducing lung complications and accelerating oxygenation recovery. Stress management is another pillar of smart preparation, because psychological stress triggers hormonal cascades that elevate blood pressure, increase heart rate, and impair immune response. So incorporating relaxation techniques such as guided breathing, mindfulness, light stretching, or calm evening routines can lower baseline stress markers and improve sleep quality, and sleep itself is a powerful modulator of healing capacity, meaning establishing a regular sleep schedule with adequate duration prior to surgery enhances immune efficiency and metabolic stability. Patients should also focus on weight management where applicable, as even modest improvements in body weight can reduce surgical strain on the heart and lungs. Though extreme dieting immediately before surgery is not advisable, and any weight adjustments should be gradual and medically supervised. Organizing the home environment for post-surgery recovery is another critical yet often overlooked preparation step, including arranging a comfortable sleeping space that minimizes strain on the chest, preparing easy-to-access clothing that avoids overhead lifting motions, ensuring medications and water are within reach, arranging transportation for follow-up visits, and planning nutritious meals in advance to reduce stress during the early recovery period. Education plays a major role in optimizing outcomes, as understanding what to expect in the hospital, how chest tubes, monitoring wires, or temporary pacing devices may be used, and how early mobilization works helps reduce fear and increases cooperation during recovery milestones. Patients should discuss any herbal supplements or over-the-counter medications with their surgical team, as certain agents can increase bleeding risk or interact with anesthesia, and maintaining open communication ensures that the medical team can tailor care appropriately. Family involvement also enhances surgical success because emotional support, assistance with logistics, and encouragement with medication schedules or breathing exercises significantly influence recovery speed, so preparing caregivers in advance fosters smoother transitions after discharge. Another powerful lifestyle shift involves committing mentally to long-term cardiac rehabilitation. Even before surgery occurs, reframing the procedure not as an isolated event but as the beginning of a structured journey towards stronger cardiovascular health, which increases motivation to adhere to exercise, nutrition, and medication plans afterward. Maintaining realistic expectations is equally important, as understanding that fatigue, temporary discomfort, and gradual stamina rebuilding are normal prevents discouragement and anxiety during early healing phases. Preoperative dental and infection checks may also be advised in certain cases, particularly before valve surgery, to reduce the risk of infective endocarditis, and addressing minor infections prior to surgery protects overall outcomes. Metabolic optimization extends to maintaining stable blood sugar levels in diabetic patients, as hyperglycemia significantly increases postoperative infection risk and prolongs wound healing. So careful monitoring and coordination with healthcare providers before surgery are essential. Patients should also begin practicing gentle coughing techniques with chest support to prepare for postoperative respiratory hygiene, as controlled coughing clears secretions and prevents lung collapse after anesthesia. Financial and administrative preparation reduces stress as well. Ensuring insurance documentation, consent forms, and hospital admission processes are completed smoothly, and perhaps most importantly, adopting a mindset of partnership with the surgical team transforms fear into constructive action, because patients who view themselves as collaborators in recovery tend to adhere more faithfully to guidance and report higher satisfaction and better outcomes. Ultimately, smart surgical preparation is not about dramatic changes but about intentional alignment of daily habits with physiological resilience, meaning that each healthy meal, each consistent medication dose, each short walk, each restful night of sleep, and each calm breath taken in the weeks before surgery contributes cumulatively to stronger tissue healing, reduced complication risk, improved graft or valve function longevity, and faster restoration of strength, demonstrating that optimal heart surgery results begin long before the first incision and are deeply influenced by the lifestyle foundation built beforehand, making preparation not merely a waiting period but a powerful proactive phase in the journey toward renewed heart health.